One of the innovative ways that Manitobans can get same-day joint replacement is through the Boundary Trails Health Center, BTHC, a hospital located between Morden and Winkler in southern Manitoba. BTHC has a dedicated surgical program that offers a variety of services, including orthopedics, gynecology, dental and general surgery. BTHC has also implemented a same-day surgery system that allows patients who can safely recover at home to be discharged on the day of their procedure. This system has many benefits for both patients and the health system. For patients, it means less time spent in the hospital, less risk of infection, faster recovery and more comfort at home. For the health system, it means more efficient use of resources, more capacity for other acute patients and more access to care for people living in rural areas. BTHC has been able to perform nearly 30% more hip and knee replacements than expected in 2023, thanks to the support of the Provincial Diagnostic and Surgical Backlog Task Force and the collaboration of its staff and units. BTHC is one of the leading facilities in Canada that offers same-day joint replacement surgeries. It has achieved this remarkable feat by following strict criteria for patient selection, pre-admission education, anesthesia protocols, pain management, post-operative care, and follow-up. BTHC has also invested in special surgical equipment and staff training to ensure high-quality outcomes and patient satisfaction. BTHC is an example of how surgical capacities are helping Manitobans get same-day joint replacement and improve their quality of life. One of the benefits of same-day joint replacement surgeries is that they help ensure hospital beds remain available to those who need them most and build capacity for other parts of the facility. This is especially important in times of high demand for healthcare services, such as during the COVID-19 pandemic. Same-day joint replacement surgeries are performed on patients who can safely recover at home without requiring an overnight stay at the hospital. This means that they can enjoy the comfort of their own environment as they heal and access physiotherapy and rehabilitative treatments as part of their continuum of care. By freeing up hospital beds, same-day joint replacement surgeries also allow more patients to access other types of care, such as emergency, intensive care, or diagnostic services. In Manitoba, same-day joint replacement surgeries have increased significantly in the past year, thanks to the funding and investments from the Diagnostic and Surgical Recovery Task Force, DSRTF. The DSRTF was established by the Manitoba government in December 2021 to address the backlog and waitlist of surgical and diagnostic cases caused by the pandemic. The DSRTF has funded projects that have increased the overall surgical capacity in the province, including the number of hip and knee surgeries. More than 6,000 procedures were completed last year, with 600 of them funded through the DSRTF. One of the healthcare facilities that has benefited from the DSRTF funding is the Boundary Trails Health Center in Winkler. The center completed 639 hip and knee replacement surgeries in 2022-23, which was 139 more than planned. More than half of these surgeries were done on a same-day basis. The center is also undergoing a major capital renovation project that will add acute care inpatient beds and provide a larger, modern space for patient programs with an investment of over $64 million. Haney Asham, an orthopedic surgeon at the Boundary Trails Health Center, said that same-day joint replacement surgeries are good for the healthcare system and Manitobans in general. He also noted that such surgeries can transform a patient's life by improving their mobility and reducing or eliminating their joint pain. Peter MacDonald, chair of the DSRTF Steering Committee, said that he is proud to celebrate the success of the hip and knee program at Boundary Trails Health Center and other facilities across the province. He said that by offering more same-day joint surgeries and exceeding their targets due to increased capacity, more Manitobans are regaining their mobility and experiencing reduced or eliminated joint pain faster.